This is where things get really interesting. Trust me, you don't want to miss this. So let's go through to part 2 and let's go even deeper. Mounjaro, part 2. Myths, conspiracies, and what doctors aren't saying or are saying. Alright, welcome back. If you haven't watched part 1 yet, pause this, go check it out because we've covered a lot. Now let's get into the wild side of the whole Mounjaro versus Ozempic craze. The myths, the conspiracies, and the facts that even some doctors aren't talking about. First up, all GLP-1 drugs are the same. It's a myth. Reality? No. Ozempic and Mounjaro work differently. Let's tackle the big myth. The idea that all GLP drugs like Ozempic and Mounjaro are interchangeable. They are not. Here's why. Ozempic and Mounjaro are not the same thing. Ozempic semaglutide works by targeting one key pathway in your body, the GLP-1 receptor. This helps enhance insulin secretion and control blood sugar, slowing gastric emptying and reduce appetite. It's like a single tool doing a solid job. Mounjaro, tirzepatide, is a pharmacologically distinct molecule from Ozempic semaglutide because it is a double-action drug, a dual agonist targeting two pathways, the GLP-1 receptor and the GIP receptor. While Ozempic targets the GLP-1 receptor, Mounjaro also stimulates the GIP receptor. GIP is an incretin hormone that further enhances insulin release and may influence lipid metabolism and energy balance. This dual action is thought to contribute to the greater weight loss observed in a major clinical trial called SURPASS-2. Why does this matter? Yes, and this is critical. It doesn't mean Mounjaro is better for everyone. Some people respond better to Ozempic. Others might struggle with Mounjaro's side effects. Response to these medications can vary based on individual factors. It's about finding the right fit for each patient. So now you know the key takeaway. Ozempic, a single pathway GLP-1 proven for blood sugar and weight loss. Mounjaro, dual pathways GLP-1 and GIP, may lead to greater weight loss in some. No one size fits all. Genetics, side effects, and health goals all play a role. I will list these references for you, for clinicians and curious listeners who wants to know more about it. They will be in the description below. We go on to the second myth, that these drugs work only by making you eat less. Not completely true. Why this matters? Beyond hunger, for many people, overeating isn't just about hunger. It's about cravings, stress, or habits. These drugs tackle both the physical and emotional drivers of eating. The real-world impact. Patients often say they stop obsessing about food. That's likely because these medications interact with the brain's reward centers, reducing the rush from unhealthy foods. There has also been report that they also stop obsessing or craving their cigarettes, alcohol, and other bad habits. So the key takeaway, not just a hunger drug. These medications work on two fronts, your gut and your brain. Individual responses vary. Some people see dramatic changes in cravings, others don't. So again, it's not one size fits all. Reality, they also target your brain's relationship with food. Let's bust the second myth, that the idea that drugs like Ozempic and Mounjaro only work by suppressing appetite. The idea that these drugs work only by making you eat less is an oversimplification. While it's true they make you feel fuller, and there's a lot more going on under the hood. Research shows that their effects extend further into the brain's reward system. The gut effect, appetite and satiety effects. Traditionally, these medications are known to enhance satiety by acting on the GLP-1 receptors in the gut. Think of it like this, like your body hitting the pause button on cravings. This leads to slower gastric emptying and increased insulin secretion, which in turn helps regulate blood sugar levels, and reduce overall food intake. 2. The brain effect. Influence on the brain's reward system. Emerging studies indicate that GLP-1 receptors are not only located in the gut, but are also present in brain centers involved in reward and pleasure. They dial down and they dampen the pleasure and curb cravings and reduce the drive to eat for pleasure, especially high-calorie foods like pizza, ice cream, and cakes. By recognizing that these medications affect both satiety and the reward system, we gain a more complete picture of their benefits. This broader understanding helps clarify why some patients experience profound changes in eating behavior that go beyond simply feeling full. I've also listed the references of this section in the description for you. Third, and then there's the big one. If you take these drugs, you'll never gain weight back. Have you heard that?